Okay, so this is the final topic to be taught to this batch, your batch final topic, clinical examination. Because everything is done, respiratory system, cardiovascular system, before the general physical, history taking general physical examination, respiratory system, cardiovascular system, general examination of the abdomen is done, then cranial nerves, higher functions is done, sensory system is done, motor system will be completed today. Reflexes is a part of the motor system because ultimately a motor nerve. What are the so first we will, already theory has been discussed. We have to learn the definition. That means we have learned the definition, and then there is something called the reflex arc. So it starts where it starts. So my hand is touched. So think of the withdrawal reflex which you have read in school days. Hand touches a hot object. So which part of the body is now the stimulus is applied to which part of the body, and it is hand is withdrawn. So it is the skin. Now from there it has to travel to the center. What is the center? Through what it will travel? Something called the afferent neuron, sensory neuron. There will be a center. Then it will be integrated at the center. Then there will be a efferent neuron or the motor neuron, and then the action will be there. So that is about the withdrawal reflex. Like in reflexes, for clinical examination, we have to know that whenever a part of the, it may be that the skin or the mucous membrane of certain parts of the body stimulated appropriately can elicit such type of responses, and these are simple but stereotype responses. One type of reflex, every time it will be the same, and it is not under voluntary control. So reflexes from the clinical examination point of view, we can study it like this classification: superficial reflexes, where the skin or mucous membrane is the part of the body the stimulus is applied to the skin or mucous membrane, and superficial reflexes are sometimes integrated at the spinal level, and the reflex pathway it does not travel to the brain. And superficial reflexes based on spinal nerves, superficial reflexes based on cranial nerves, and we have to also know those are called the root values, that which level of the spinal cord that particular reflex is being integrated. Like something from the hand, it will be some reflex associated with some part of the hand. So that will be some muscle of the hand that will be integrated by mostly by the cervical, at the some cervical level of the spinal cord. But for the foot or the lower limb, not only the foot, it is wrong to say foot only, the lower limb, thigh, leg, foot, wherever, at the lumbar level, like this, at the lumbar level of the spinal cord, at some, so that is, if it is like say 5th and 6th nerve roots, spinal nerve roots. Actually, for your these you have a basic idea you should have from your school days itself, but this time the topics we have taken has been a bit haphazard. The order has not been maintained like that. So organization of the nervous system, we are keeping a class on this Saturday. But how is the nervous parts of the brain, everything, forebrain, midbrain, hindbrain, and spinal cord, motor, the horns of the spinal cord. I think the motor system is going on, so it has been discussed to some extent, and you have a basic idea. But the first class on cranial nerve CNS should be organization of the nervous system. It should not be like sensory, but because of lack of time, we had to teach those topics first, from which questions are we have to go by the exam point of view this time. Like these should be taught, cranial nerve should come after this, but this time it was a bit haphazard. Anyway, reflexes based on spinal nerves, reflexes based on cranial nerves. Like we have done some of them as cranial nerves has already been discussed, which actually the order should be cranial nerve should be discussed later after the motor system. I forgot to mention when I was mentioning the topics. So cranial nerves has also been discussed. So superficial reflexes based on cranial nerves we have already done, like the corneal reflex, the conjunctival reflex, and the palatal reflex. When you have done the 9th, 10th cranial nerves, palatal reflex. So if you touch the base, say with a spatula is not, there is no spatula over here. It is done usually with a spatula. If you touch the uvula, then there is a response. That is called the palatal reflex. The movement is there. That can be noted. Corneal reflex, we touch the the junction of the sclera and the corneal edge. It is never touched in the center because there is chance of corneal ulceration. With a cotton, conjunctival reflex similarly it is done. So that is these are the superficial reflexes based on cranial nerves. So what are the afferent neurons and efferent neurons, you know, and all these days exams are like this. There are objective structured questions. So there, if the picture is given, you have to write the afferent and efferent. We have already discussed cranial nerves. Never write this C6 or C7. So these C6 or C7, C6, C7, these are the root values of the nerve roots of the spinal cord, which we will just now discuss the reflexes based on spinal nerves. There the root values are written like this, C6, C7. So when you are to mention about the cranial nerves, write this C capital, N capital. If you can write the whole thing, 7th cranial nerve it is based, and the name 7th cranial nerve, facial. Otherwise write CN7 dash facial. So superficial reflexes based on cranial nerves, as we have discussed the cranial nerves and clinically examined, we know those. And superficial reflexes, there are superficial reflexes based on spinal nerves, like the one at least from the examination point of view, you have to show during the examination common. There are many. Most will not be asked in the exam, at least in the physiology exam, due to different issues. Which issues we have been discussing? We have been we have been mentioning throughout this first year of medical school. In clinical examination, what are the issues? Usually your own subjects in the first year, your own friends, our own colleagues are our subjects. There are privacy issues. So nobody will ask you to say on your male colleague, nobody will ask you to in the exam, just they will be asked orally. Nobody will ask you to say the cremasteric reflex or even the abdominal reflex. So there are privacy issues, exposure and all. But only the plantar reflex. There are so many superficial reflexes based on 5 or 6 or 7, based on spinal nerves. So they are integrated in the center is some level of the spinal cord. Plantar reflex. Plantar reflex it is elicited at the plantar surface of the foot. So what is done? So before that, what do we use for eliciting reflexes? These reflexes, this is called the clinical hammer. Clinical hammer. You have to know about the parts, like parts of a stethoscope, this handle and all, and you see this can be, sometimes this can be opened. So see. So this can, see, after opening, these are these feather-like structures. So this can act also as to examine the sensory system, fine touch, like this. Okay. And there are further, more pointed ends are also available. So there are different types of hammers. Here there are only this type of hammer is there. The rounded top hammer is also there. It is not right now. It is not over here. But this type of hammer, See, at the top there is there is a blunt end, and there is pointed end, and this is the blunt end. So there are two ends. So why this is called the clinical hammer or the patellar hammer? Because why it is called the patellar hammer, or sometimes also the knee hammer? Because the knee jerk, the reflexes, some of the reflexes are also called jerks. The knee jerk was the first to be elicited. Historically, the knee jerk was the first one to be elicited. So what do we do? This with the clinical hammer, we use the as much pointed end. It is best to use for the plantar reflex. It is best as much pointed, even say without hurting the person. Even the tip of a compass can also be used. Sometimes if nothing is available in the words, sometimes hammer is not available, we cannot, the hammer is not being found, we even use our own say one key. So we drag it along on the lateral surface of the foot towards the great toe, like this. So if this is the surface of the foot, this is the great toe, like this. We drag it from here, the hammer, and we go. This is the direction. So what is so as soon as this thing is done, what is the response? The response is plantar flexion of the toes. Plantar flexion. What will we mean by plantar flexion? Which is the plantar surface of the foot? When we are standing, the surface which is below, that is the plantar surface of the foot. So plantar flexion, plantar flexion means if this is, what is this action? This is palmar flexion. So plantar flexion is the toes will be flexed towards the plantar surface, and if the toes are flexed towards the opposite side, it is called dorsiflexion. It is actually extension. It is dorsiflexion. So this is the wrist, my wrist. So this is wrist flexion. This is wrist extension. This is elbow flexion. This is elbow extension. Like that, if the toes of the foot are, suppose this is the plantar surface. Plantar surface of the foot is the corresponding surface to the, plantar surface of the foot is the corresponding surface to the palmar surface of the hand. So if this is like this, palmar flexion, and that is towards the plantar surface is the plantar flexion. This is the dorsum of the hand. So this is extension of fingers if it is not possible to that extent, but voluntarily. But this is the, if the fingers are comes towards the dorsum of the hand, then it will be, it is extension. If this is flexion, this is actually flexion, this is extension, but that is not called extension, that is called dorsiflexion. That is flexion as if it is the flexion towards the dorsum. So whenever there is some abnormal, so what is the normal response? Towards the plantar surface. And what is when there is some abnormality, like reflexes are there, the pathway, reflex pathway involves the upper motor neurons also. If there is a upper motor neuron lesion, then firstly reflexes are sometimes there are exaggerated. So these things will be, I think, has been discussed in theory, or it will be completed the next day. So reflexes are exaggerated because to maintain not to maintain, so that the reflexes, whatever we call normal reflexes, which we learn here physiologically, that normal response is due to some prevention of excessive lower motor neuron activity, and that is done by that is one of the functions of the upper motor neurons. If that is absent, when the upper motor neuron lesions are there, then reflexes are exaggerated, and reflexes are, in this case, like in plantar reflexes, instead of plantar flexion, there will be dorsal flexion, dorsiflexion. It happens in case of the plantar reflex, it happens in adults. This is the, obviously this is a plantar flexion. Even at a children 5 years of age, it is plantar flexion. At 3 years of age also, but infants, it will be dorsiflexion, because the upper motor neuron, the pyramidal tracts, which has been discussed, I think, there have been 3 or 4 classes on motor system by now. It is this plantar, this is upper motor neuron. There is the, instead of the pyramidal tracts below the 1 year of age are not developed. During deep sleep, they are inhibited. So during deep sleep also, the response will be opposite. In a sleeping person who is in deep sleep, if you try to elicit this reflex without awakening him, then or her, then there will be this plantar flexion. This you have to show in that. This is important from the examination point of view. Plantar flexion has to be demonstrated during the examination. You have to practice it, and if you don't have the hammer at your wherever you are living, home or hostel, you can try it with any pointed object, even with a key. You can try it. You can, that means you can practice it. So there will be the plantar flexion. But reflexes are such that reflex is such a thing. If you do it repeatedly on the same person twice, thrice, then the response, then there is a, like when you learn in pharmacology, you learn the term tolerance to a drug. That means tolerance. Tolerance means the action is not as it is expected to be. If you do it 2 or 3 times, it is not called tolerance here. That means there is some kind of adaptation. The action will not be as it is expected. So first time you have to elicit it. So plantar response reflex can usually be elicited very easily. So this is a superficial reflex. That means skin is being stroked with the hammer. Others are which will usually be not asked in the exam. You just read from the book and know about it. I'll just mention them. Abdominal reflexes, stretching the skin. These are also, abdomen exposure is not still a privacy issue, but still abdomen, if you scratch the skin of the abdomen parallel to the costal margin or inguinal ligaments, there is a ripple of contraction of the underlying abdominal muscles. This is the abdominal reflex. And you have to learn about the root values also. Plantar reflex, as far as I remember, it is L234, I think. L2, write like this. L234 or 345. L234. If I am wrong, I have to correct it from the book. If this is the book by Ekejan, is it L234? I think L234, not 345. So we write like this. Whenever more than one root is involved, level L234 is, see which of these? Any of these? L112 is cremasteric. Okay, L234 is okay. Sorry, L234 is knee jerk. Okay, just close it now. So those are the deep tendon, not L2. I'm sorry. This is L5S1. Sorry. So plantar reflex is L5S1. Yes, sorry. So we should apply some common sense also. Why did I make the mistake? Plantar is the lowest part of the foot, so it should go more downwards. L5, fifth lumbar and first sacral, and knee jerk, which were coming later. Knee jerk is a deep tendon reflex, that is L234. So always apply some common sense. I did not apply it right now, and so I made the mistake. If you forget, apply common sense. Foot is the lowest part, so you come down to the lower part of the vertebral column. It is L5S1 in this case. So this is the plantar reflex. So there are the others, as you have the book. So others are abdominal. See, there are mentioned cremasteric, bulbocavernous, superficial reflexes. Bulbocavernous, okay, and anything I am leaving out? Anything I am leaving out? Plantar, then it is mentioned abdominal. Based on spinal nerves, plantar, abdominal. Third one is not third one. There is no specific order. What is given? Scapular reflex, between the scapular. So between the two scapula, if the skin is stroked, so there will be contraction of supra and infraspinatus. So all these are elicited. You see, sometimes if it is done twice or thrice repeatedly, sometimes there will be no response. You have to wait for some time again and do. So there will be contraction on supraspinatus. And in abdominal reflex, the ripple of contraction can just be seen. Exposure is very important in reflex. Exposure of the muscles which are expected to contract, they have to be exposed. If that is not done, that is a basic primary mistake and 0 may be awarded. From the examination credit point of view, 0 may be awarded because you are not even exposing then what you will see. Okay. So these are all superficial reflexes, screen stroke, cremasteric reflex, bulbo will at least not be asked here due to privacy issues. But superficial reflexes based on cranial nerves is given on the next page, corneal, conjunctival, these are the pictures. It is better to see, of course it is better to see videos rather than pictures. In our days when we studied, so options of watching videos were limited. But you may see, but you have to choose authentic videos, okay. I will not name any because I don't want to promote any, nor any book, nor any video, but you have to choose authentic videos where it is properly done, which will suit you. So, from our point, from here we will practice it in the class. But these things, so corneal, conjunctival we have already done during discussing cranial nerves. We have also done the, sorry, jaw jerk is not here, jaw jerk is this palatal reflex. So, we have also done this corneal, conjunctival and palatal reflex. So, see, these are the superficial reflexes. Some are based on spinal nerves, few are based on cranial nerves, and the difference with the reflexes is where this stimulus is applied. Superficial means stimulus applied on the skin or mucous membrane. As you have the book, you should have the book. I have told, so this is the last class. So still you are not having one of the books on practical physiology in the class, but you should have. The deep reflexes are, it is, the stimulus is to the tendon of the muscles. So these are, examples are, so now what is the sensory organ here? This is what has been discussed on Saturday. I think very, so when you read about the reflexes, what is the sensory organ? Why, when we the stimulus is applied to the tendon, which is the sensory organ in the muscle, which is muscle spindle, which is this, and the motor neurons are involved are alpha and gamma. So these are the, then we have to read about something called the Golgi. So theory is a bit, theoretical part is a bit you have to understand and study. So there is the Golgi tendon organ, what is happening in each case. So these you have to study. These things you have to learn, or you have learned. So I think it will be completed the next day and a new topic will be started. So these are the first, if we want to discuss, first we should discuss the knee jerk and the biceps jerk. Again, from the, these are the most commonly asked in the exam. From the examination point of view in the first year, these are the most commonly asked. And which is, among these two also, which is most common, more common, biceps jerk, because again exposure privacy issues are minimal. What you have to expose? This part. This part has to be exposed. And now what is that mistake which I just mentioned 2 minutes ago, 2-3 minutes ago? What is the mistake? Sometimes you forget to, so it is the, it will be elicited by eliciting the stroking the tendon of the biceps. By now, with all the knowledge of anatomy in the whole of the year, it should be simple. Biceps tendon is in the antecubital fossa, cephalic vein, biceps tendon, and the brachial artery, which is involved in measuring estimation of blood pressure. Cubital, antecubital fossa. Cubital, C-U-B-I-T-A-L, antecubital. So this is the biceps tendon. It will be stroked by, so keep your own finger and then stroke it with the other hands. Keep your finger on the examiner's, on the subject's biceps tendon. Ask him to the semi-flex, semi-pronate. Keep it where we have semi-flex, semi-pronation of the wrist. Where we have done it? Semi-flexion, semi-pronation of the wrist. Palpation means pulse, examination of radial pulse. So like that, do like this, keep it there and stroke it with the broad end, where the, pointed end, where the tendon is stout and narrow, and but the tendon of the triceps is broad and thin. There we use the broader end of the this clinical hammer. So biceps jerk, if we stroke the biceps tendon, and you have to keep the thumb, your thumb, because biceps tendon is stout, to prevent some injury and also to elicit the response appropriately. So you should keep a thumb. In case of the biceps tendon, as it is so stout, keep a thumb, keep your own thumb and stroke with the pointed end over your thumb. The biceps tendon, again now this whatever we have read in the theory, muscle spindle is the sensory organ, and what will be the response? What should be the response if there is a proper response? The contraction of the biceps can be seen, that is why it is to be exposed. If exposure is not done in reflexes, it is a very basic mistake. Biceps tendon is to be exposed and flexion of the elbow. Whatever contraction of the biceps results in flexion of the elbow joint. So this thing should be elicited. Sometimes in reflexes, remember, it may not be elicited in one attempt. So you have to repeat it and you have to give some time. Trying to elicit it twice or thrice repeatedly, it is not possible. So you have to give some time. Okay. Similarly, during knee jerk, you have to make usually you make the person sit. It can be also done supine, but you make the person sit, and with the broader end, this time no thumb is required, it is not so stout and narrow. You have to midway between the origin and insertion of the patellar tendon. So what is, where it is stroked like this, but what has to be exposed? The quadriceps muscle. So a bit of privacy issues may be there. So sometimes in the exam, from the first year examination point of view, the examiner even tells, okay, do it over the clothings, that is, he or she gives the permission, do it over the clothings, but you do the procedure correctly. In first year, more or less in every clinical examination, we are concerned with more than eliciting getting the result, whether the procedure is correct or not. So you do it. So ideally means it has to be, to see the note the contraction of the quadriceps and extension of the knee joint. So if the person is like sitting over here, sitting over couch, and the leg is hanging like this, so as if you have to do from just the side, because the leg will go like this, the knee will extend and the leg will move forward. So remember, so that it does not hit you. So you have to just move to the side and elicit it. But you have to, so this part, the upper part of the thigh, this thigh has to be exposed. This is, so if there are privacy issues, then the examiner in the first year, when you will go to the wards, obviously you have to keep female attendants in female patients, male attendants if you are female examiner, female clinician in female patients, and all whatever we have learned throughout the year from the first day of the clinical examination, and you have to elicit it by proper exposure. But here in the first year, I think the examiner will ask you, even if he or she permits to do it over the clothings, you have to do the procedure correct. But so what is most commonly asked is the biceps or something from the upper limb, brachioradialis. So semi-pronated arm, now brachioradialis, where the stroke is made on the tendon of the brachioradialis. It is adjoining the scapular, not scapular, this is the styloid process of the radius. Styloid process of the radius. If the stroke is made, then there is full, what is the result? Read the brachioradialis reflex. Supination of the elbow. So this is what is the response. And for the triceps will, contraction of the triceps will extend the elbow. So when we stroke the tricep tendon of the triceps, then what will happen? This action will take place and also the contraction. So on your colleague in the first year, what will happen? The subject will be asked to open the shirt, and biceps, triceps jerk, supinated jerk, these can be asked during the exam. And even the ankle jerk, there is no privacy issue like that. Ankle jerk can be asked. So ankle jerk, what it is written? Stroke where? Strike the, just read it out. Right, place the lower limb. Read. Read loudly. Place the lower limb in inverted. Dorsiflex the foot and. So dorsiflex the foot means dorsiflexion we just learned during plantar reflex. So you have to do it voluntarily before dorsiflex. Then you have to strike over the not the foot. Tendon on the posterior surface. That means on the posterior surface of the ankle. Now what happens? What is the result? Gastrocnemius is seen. So that is, so where is to be exposed? Where does the gastrocnemius muscle, calf muscles, posterior aspect of the leg? So this part has to be exposed. So this can also be given because privacy issues are less. But people will come to the exam, your colleagues will be coming to the exam using, I think, trousers. So if the whole trouser has to be taken off, again there is a privacy issue. So usually biceps jerk is what is asked from the, but you should know about all these. Okay. So all these things today you have to go and read, and then there is the one jerk is there is the jaw jerk. Jaw jerk, what you do, we have already learned. What are the cranial nerves involved? Both are trigeminal, both are fifth. Okay, afferent and efferent both are fifth. Keep the, again, as it is, again, here you have to keep the thumb and strike with the hammer after. So first you have to ask open the mouth like this, slightly open the mouth, keep the thumb, strike with the hammer, and it will result in contraction of the masseter muscle and closure of the jaw. So reflexes just can't be learned like this. On Monday you will practice it also over there. There are only 9 people. If the rest want to pass the exam, ask them to come, because most of them, what they will do, they will not go, and everything what you are doing, you are carrying the habit what you did in school. After going home, just studying theory. Persons who are studying at all, studying only theory. So clinical examination without practice you can't do. So ask the others to, there is none, both the class representatives are absent, roll 75 and 82. One of them I saw yesterday in the camp. I don't know what they are doing. What is the point of being elected as a class representative if you don't attend classes day after day? If there is any issue, personal issue, then he or she should inform. So you have to do, you have to practice. So today you read about this, as you have this time, at least we could do one thing, although the topics were order was haphazard. At least these two topics, or the whole motor system, we did theory and practical parallel. And reflexes we will take another class. You will practice it on Monday. There will be, if there at least even 40 people attend, it is, and the faculty will guide you. Now just sit over here so you have been asked to name the superficial reflexes based on spinal nerves. এইরকম যদি অবস্থা হয়, এক্ষুনি পড়লে এক্ষুনি ডিসকাশন হলো, খালি প্র্যাকটিস হলো না, আমি নাম বলতে বললাম, তোমাকে বলতে বলা হলো স্পাইনাল নার্ভস, তুমি বলতে থাকলে ক্রেনিয়াল নার্ভস। আর একটু পিছিয়ে যাও, ওই চেয়ারটায় বসো। Page after page. Theory exam is for answering the question, not writing whatever I know about the topic. So 4 pages should suffice maximum. One has been given, 1 into this 2 and 2 into 4 pages should suffice. Not more than that.
its area